Hello, my name's Kiah Morris, and I am the Director for the Alliance for Community Transformations. We want to welcome you today to this discussion around creating smoke-free housing. This is information that's especially useful for owners of rental properties here in the area, and we have some special guests with us here today. We have Rebecca Ryan, who is the Senior Director of Policy for the American Lung Association of the Northeast. We also have here co-owner Troy Richardson of Maple Leaf Realty, who himself has dealt with a number of different issues, including converting units to smoke-free properties. And so this is a topic that's coming up and has great importance on a national level. These are trends that we're seeing happening everywhere. And I'd love to get your feedback a little bit from why you think smoke-free housing is important.
So from a public health point of view, there's no safe level of secondhand smoke exposure. And in an apartment building in particular, there's really no separation between apartments, so you could think about it as a big house. And if somebody's smoking in one apartment, the smoke will actually, it's gas, so it will expand and move through the windows, through microscopic cracks, through the ventilation system. So if somebody is smoking in one unit, everybody in that building is breathing that secondhand smoke.
Correct. And so secondhand smoke is the smoke that's emitted from a lit cigarette or pipe or device or anything like that. Why is that so worrisome?
Well, it's worrisome because there's over 7,000 chemicals in secondhand smoke, and of which 70 are cancer-causing. So we've got formaldehyde and lead and a number of toxins that actually are regulated by the federal government on a number of issues, but not in terms of secondhand smoke exposure. So it's very dangerous, particularly for pregnant women, for children whose lungs are developing, and for people with chronic lung disease. Chronic disease of any sort. In particular, we're concerned about lung disease.
Yes, absolutely. Well, so when we think about that, so we think about how it could impact particularly vulnerable systems, like you said, a pregnant mother or young children who are still developing, or the elderly, those who are immune compromised. But what other health effects does secondhand smoke actually have on the general populace?
On anybody, it can cause respiratory issues, and it can lead to chronic disease. So really nobody should be exposed to secondhand smoke.
Now, I saw a study once that talked about the link between secondhand smoke and heart attacks, secondhand smoke and strokes, and I've even seen some work out of the American Academy of Pediatrics that speaks about particular ADHD and different learning disabilities in children who are experiencing secondhand smoke. Is there validity to those claims?
Absolutely. In terms of short-term exposure to secondhand smoke, the studies have shown that people that have a predisposition for heart disease can actually have a heart attack after a very short-term exposure to secondhand smoke. And in terms of children, yes, especially a mother who continues to smoke through her pregnancy the child that is born can actually have a learning disability.
Wow, that's really powerful. So can we talk also a little bit, so when we're thinking about an enclosed environment, you'll have the opportunity to be exposed to secondhand smoke. What is third-hand smoke, and why does that have a role within the indoor environment?
It does. What happens is it's the residue that remains in the carpet, in the furniture, and that can be long-term. It's hard to get rid of that, as probably Troy can attest, out of the fibers. And if there's a child in the apartment of the smoker or an animal that's close to the floor, that can really impact the child the same way as regular emissions that you see from the tobacco product.
Wow. So I'm thinking, as I'm visualizing how someone would come in contact with third-hand smoke, a child might touch a surface, and then most babies, for example, automatically put their hands in their mouths. You'd mentioned pets. That's something I don't think a lot of people have heard about. What are the effects of the exposure to second and third-hand smoke for pets?
So both cats and dogs can develop cancer from secondhand smoke. And if a dog in particular, I'm not sure a cat would do this, but if a dog gets a hold of a butt of a cigarette, it can cause severe respiratory distress in that animal.
That's frightening. And there's some animals that are very vulnerable to that. I have a German Shepherd with a long nose cavity that could bring that. nasal cancer. But then I also think about the third-hand smoke with cats and how they're grooming. And I would imagine that that probably also has an impact on their
I
health
would
too.
imagine.
And birds can't be exposed to most anything, so that
That's
would
a good
also
point.
be.
Right.
You can't even have aerosols
Right.
around
Right.
birds, so I
Yeah.
can't even imagine what tobacco smoke might do to a system. So when you spoke about the dangers of it in a living environment, and particularly in a place where there's multiple units, you'll have the smoke traveling through ventilation systems. So, and then it also kind of hangs in the space, correct? Just sort of hangs on to the surfaces in the air. Now, how difficult is that to actually remove? Is it something that can be done, or do you have to essentially gut the place and start from scratch?
Well, I'm going to get this. I have the acronym, but I'm sure I'm going to get the organization wrong. ASHRAE, the American Society of Refrigerating, Engineering, and Air Conditioning Engineers. I did it. Said in 2005 that the only way to eliminate secondhand smoke is to create a policy. So you can't, no matter what you do. I mean, there's ways that Troy could talk about to mitigate the effect of secondhand smoke in a unit, but in terms of eliminating secondhand smoke from that environment, the only way to do that is to implement 100% smoke-free policy. And this is not, this is coming from an engineering society, not a public
Right.
health organization.
Right.
Very powerful.
That is very compelling. So I think when people think, I mean, I know here in the Bennington area, we've had many public debates and discussions around how marketable are our apartments, the facts that there are vacancies and we have trouble filling certain rentals. So I could imagine that some of the concerns someone might raise are, well, if I do that, am I going to then lose out on tenants? Can you speak a little bit around whether that's true, or what pieces of that are true or not true?
Yeah, and Troy, I'm sure, can talk about that in more detail, but there was a survey done in Vermont just a few years ago, and 70% of Vermonters said they were likely or very likely to choose a smoke-free property over one that allows smoking. That's a huge majority. Residents really like smoke-free living, even among smokers. Smokers are very used in public and workplaces to taking it outside. And so in their homes, they appreciate having a smoke-free environment as well.
So how does that help the smoker in particular? If we want the smoker to quit, ultimately would be the hope, but even if they don't, how does that help them as far as improving their health?
It's going to reduce their exposure, so it will help them to some extent, although if they're still choosing to smoke and smoking outside, they're still going to, probably have some sort of chronic disease related to that. But if they have family members or animals, they're going to dramatically improve the quality of their life and their health.
Wow. So how easy is it for a person to actually quit tobacco?
It's not. But what we know from decades of practice is that, smoke-free policies motivate people to quit smoking. Most smokers want to quit. Most smokers have tried to quit in the last year, and if they're living in a smoke-free environment, they're more likely to give it another shot and be successful at it.
That's great. That's great. So what about some of the other emerging trends with tobacco? So if, let's say, a landlord did want to create a tobacco-free policy, so not just a smoke-free policy, but a tobacco-free policy, how do e-cigs, vaping, those types of things fit into that as well?
Electronic cigarettes are actually not a new trend. They've been around for a while, and the public health community is trying to catch up to what's happening with the use of electronic cigarettes. The rate has tripled among youth nationwide. The challenge with it is we don't know enough about what comes out of the end of an electronic cigarette, but the science is starting to show that it's actually an aerosol, which is creates particle pollution, which if you inhale it bypasses your natural defense system, goes through the lungs into the bloodstream, so it can create havoc. So we recommend, the Lung Association recommends including electronic cigarettes in any smoke-free policy that a property is considering.
What about considerations around medical marijuana?
Yeah, so medical marijuana is legal in Vermont. It's still not legal federally, so there's that concern from a property manager's point of view. But if a person is prescribed medical marijuana, there are ways to consume it without smoking it. So we would just recommend that you include medical marijuana in your policy, and then the resident can actually find another way to ingest marijuana without smoking it.
Mm-hmm. So let's talk a little bit about the legalities and the liabilities. So I'm sure people are saying, but you can't discriminate against a smoker. You can't say, no, I don't, I don't want to allow you to smoke. Some people say, this is my home. Why can't I smoke within my own home?
Mm-hmm.
This is impinging on my freedoms. It's impinging on my rights.
Right. Yeah, I understand that. However, there is no constitutional protection for smokers. There's no right to smoke, either federally or statewide. However, everybody has the right to breathe clean, fresh air. Mm-hmm. So it is very legal to implement policies, and it's happening. It's a growing trend among housing providers. And in fact, right now, the Housing and Urban Development federal government is looking at and probably will implement smoke-free policy requirements for public housing nationwide within the next year or so. So that's huge. They've been recommending voluntary policy for a number of years. So this is a gigantic step forward.
Mm-hmm. Mm-hmm. So within that, I guess maybe you can speak to this as well, Troy, as someone that's helped to create leases around this. So when we think about including things like electronic cigarettes, pipes, a number of different lighted things, medical marijuana, how is this different, for example, than a pet policy? Is it different?
It should be no different. And one of the things that you're going to put on your website is an example clause from a lease that I distributed at our live seminar, and it's one or two sentences, and it just simply says that the building or the property is a non-smoking property, mm-hmm. and what the penalty is for smoking on the property. So just like it says that you can't have a pet, or there's a designated parking space, it's a policy of the property. And you, by signing a lease, are agreeing to abide by that policy. Mm-hmm. So it should be treated the same as any other policy in your lease.
So talk to me a little bit about the motivation for why someone would have a pet policy, for example, or a smoking policy. So when I think about pet policies, what are the risks that a landlord might say, I don't particularly want that within my rental?
Well, landlords decide what level of risk they're willing to take. When they take a tenant in, they are looking at risk. Because when you think about it, they're turning over a very valuable asset. Their building here in Bennington could be worth $100, $150, $200, or $1,000 or more. And they don't necessarily live there. They're turning that over to somebody else to kind of caretake mm-hmm. and live in. Mm-hmm. So they're evaluating how much risk they're willing to take by having somebody else live in that unit and take care of it for them. So pets can do damage because the owner isn't there to watch over it all the time. Smoking does damage to property. And in fact, cigarette smoking is the leading cause of fires in multi-unit buildings across the country. Mm-hmm. That's a big risk. And insurance companies recognize that risk. Mm-hmm. And some insurance companies actually give a discount if you have a non-smoking policy in your property. Mm-hmm. So the reason for having these policies in place is to protect your property and to protect your property value.
That makes sense. So so as an owner, if I don't have a smoking policy in place and another tenant may have an issue that has arisen from the secondhand smoke, what are my actual liabilities in a situation like that?
I think that I have, and this is another piece that's going to be on your website, the Institute of Real Estate Management just sent out a newsletter this summer, and there's a great piece of this article written by Frank Flynn out of Boston, and there's this case that was heard in Boston. This woman lived above a bar, and she was not a smoker, but the smoke from the bar seeped into her apartment. So she sued because she felt that disturbed her what's called quiet enjoyment. It's a legal term. But she sued, and the judge found that the apartment was unfit for smokers and non-smokers alike. And the judge found that the evidence does demonstrate to the court that the tenant's right of quiet enjoyment was interfered with because of the secondhand smoke emanating from the club below, and the judge awarded that tenant $4,350. So just by having secondhand smoke, that particular case awarded the non-smoking tenant a judgment. So that's the kind of thing that could happen in a building where the secondhand smoke is seeping into somebody else's unit who is feeling that it's infringing upon their ability to enjoy their unit.
Are there any other considerations, Rebecca?
Yeah, aside from a potential lawsuit, a person who has a chronic disease such as COPD or asthma and is exposed to secondhand smoke in a unit in which they live, they can actually file a claim with the American for Disabilities Act in the Fair Housing Act to request a reasonable accommodation, which would mean hopefully that the person being damaged by the secondhand smoke can stay in their unit and the smoker would move. And in many cases, it's moving the non-smoker to another unit away from the smoker. But in a perfect world, what would happen is there would be 100% smoke-free policy implementation, so everybody in the building could enjoy that fresh air.
That's very important. So when we're thinking about this and creating these leases, now you've had some experience as well, Troy, with trying to think about how do you connect with your prospective tenants and letting them know about your policy or implementing policies. Can you speak both of what that process looks like for you when you're going through an application process to finding the right fit for your units?
Well, what we recommend is that every applicant coming in is treated in the same manner, and that usually starts with an application. And part of our application process is there is a question, along with all the other standard questions. Do you have pets? Do you smoke? Do you have do you have a car that you'll be parking on the property? Those kinds of standard questions. But one of them is, do you smoke? So that starts the process off right there. And in all of our advertising, that for the properties that we advertise for, looking for tenants, it clearly states our landlord's policy, because we, as the real estate firm advertising, do not set any of these policies. These are all the individual owners who have made these decisions and set the policies. So we're merely advertising their wishes. So if they've decided no pets, they've decided no smoking, or they've decided cats are okay and dogs are not, that's all clearly stated in our advertising. So when you go to any of the websites that our rentals are advertised on, you'll see right in the advertisement, lovely 2-bedroom apartment located here. We'll talk about the other amenities, and then towards the end it'll talk about the lease terms, whether it's a month-to-month or 1-year lease, and then it'll talk about the other financial requirements, and then non-smoking building, no pets, those kinds of things. So be clear in your advertising, and be clear in the application process, and ask the question up front. And that sets the tone.
That's really great. So what would be the best steps, the logical steps, if someone wanted to implement a smoking policy? What sort of considerations? Indoor, outdoor? Are there foot restrictions or recommendations?
Yes, we recommend that a manager or owner start with the residents and engage them in the process from the very beginning. So if you need to do some sort of surveying, which in most cases ends out very positively, most people will support the policy, informational meetings, and then when you're ready to say, yes, we're going to do this, you have to decide what's it going to look like. As you mentioned, how far away from the building. So if you have 100% smoke-free building, are you going to include the balconies, which we would recommend? Yes, that's part of the building. And yes, if you allow smoking on a balcony, it's going to come back into the building. So, okay, so you make the whole building smoke-free. Then are you going to make the property smoke or tobacco free. I think like Troy has done, his whole property is tobacco free. That protects people who are in the building when somebody steps right outside the door and lights a cigarette, because it's a gas, it will come into the building through the windows, through the doorway, through the ventilation. So we recommend it. The science shows at least 25 feet from any of those entities, the windows, the doors, the building ventilation systems, and further, at least 25 feet minimum. And the other thing is to consider, if you have smokers in the building, whether or not to grandfather them. And we recommend that you don't, that you set a short implementation date from 30 to 60 days. And at that time, nobody is smoking. If they're still smoking, they can smoke somewhere else, but not in the building. So keep it short and don't grandfather in smokers, because there's an expectation that will continue.
So do you have an obligation to create a smoking place outside?
There is no obligation to do that. I think that's that's a consideration the owner or the manager has to make. If you have people who are not very mobile and don't plan to quit smoking, you might want to consider it. It's a pretty expensive proposition.
Yes.
So I think that's a really personal choice depending upon the situation and the residents in the building.
One of the things to consider in the implementation process is really looking at your current leases, because your current leases, depending on how they're worded and where you got your leases from, your lease may not allow you to change the rules midstream. So you may have to wait until that lease ends and you actually renew it to change the rules of the road. So you may want to look at your leases that you have in the building and figure out, is there a time that it makes sense to change the rules? Do they all renew at roughly the same time within a 2 or 3 month period, and change the rules around that time? So it's really sort of a little bit of a dance. So you want to change the rules when the leases renew, and then when they do renew, if you're going to be setting a policy in the future, when they renew, you can always say, effective on this date, we will be going non-smoking. So the lease can have that forward-looking language in it. So implementing is a little bit of a juggling act sometimes, because the other thing to do is to say, okay, we're going to renew your lease today. You're non-smoking, and then in 2 months you renew somebody else and you're non-smoking. That's kind of that grandfathering, and it gets a little complicated because you have to keep track of who is and who isn't, and you still have the secondhand smoke issue. It's better if you just say the entire property on this date and everybody is affected on the same date.
So you're saying to take a look at your language, because you may not be able to just do an addendum just midstream, essentially.
Right.
That's very important.
And if you're uncertain about the language in your lease, certainly consult your attorney.
So something that as the director of the Alliance for Community Transformations, we've helped a number of large property owners as far as like our affordable housing complexes in creating smoking policies, and each one had its own unique journey. You as well, Troy, I know that you've been a part of trying to help convert some properties, and I know that you've helped Rebecca have provided support to other entities as they've tried to make that conversion happen. What are some success stories that you've seen, as well as some lessons learned through the processes of trying to help those entities make this change, this substantial change?
The best stories I've heard is about people who are, dug their heels in and saying, okay, I'll smoke outside, but I'm not quitting. I'm not quitting smoking. I'm going to keep smoking. And then suddenly realize, you know what? This isn't so bad. I think I'm going to try to quit smoking. And then they succeed at that, and they can point back to that smoke-free policy. That's, not the point of the policy, but it's such a fantastic bonus once that policy is implemented. So I've heard a lot of really good stories about that. And I've also heard that from some folks that have supported these policy processes and the managers and owners, that the actual, thinking about it caused a lot more anxiety than the actual implementation. So the enforcement part of it hasn't been as challenging as some had expected. A couple unusual circumstances where a building is on a, they had hoped to have some sort of perimeter around the building, but the building is right up against public sidewalks. So then what do? That gets a little bit complicated, but in the end that worked out as well. So those are some unusual circumstances, I think, that make it a little bit more challenging to implement policy.
That's great. Thank you. What about you, Charlie?
Well, I think that when I first got involved with your organization and doing this a few years ago, we were talking about allowing the residents in the implementation and the conversion process a lot of time to get used to the idea and converting over a long period of time. And I think what we found was that really wasn't as successful as this short time period that we're talking about today. This 30, 60, maybe even 90-day process of, the policy is going to come into place in a very short amount of time, I think is much more successful. I think we were even saying a year. Give everybody a year's notice. Give them time to quit. And I think what we found was everybody said, oh, I'll just start that process next month. So I think this short implementation time frame has been much more successful. And certainly through the process of doing the survey, talking to your tenants, being upfront about what you're thinking about, you're going to find a much more positive reaction. This is not something you're just going to send a letter off and say, in 60 days this is happening. I think if you engage the tenants and you get them involved and find out, are they for this, they'll get behind you and they'll be much more interested in doing this. And then when you do say in 60 days or 90 days or whatever the time period is that you choose, they're going to be all for it. So I think that that's really something that we learned through this process. And one of the things that really helped in the successful implementations that we've had is really utilizing the resources that you have available. A couple of them are these brochures from 802quits.org. These brochures really are something that you can hand out as resources to show somebody, there are quitting resources. So those are something that we've used to give out to people who do smoke if they have expressed an interest in quitting. And those have been successful pieces just to show that this isn't just something that's about me as a property manager or about the owner. This is something that really is a health issue, and we're concerned about your health. This isn't about just the property. This is a health issue. And by using these materials, that really shows that it is a health issue. It's not just about the property.
And so let's take it a step further. So there's been a common phrase used in this movement talking around, it's not about the smoker, it's about the smoke.
Right.
So it's not about the individual saying, I don't want you in my property. It's saying, I'm looking for an end to a particular behavior within my property. So in the same way you'd say, I don't want you to have raging parties in my property, you would also be able to say, this is a behavior that I would like to disallow.
Yes. Well, I think that one of the stories that I told at our live seminar was that when you start to have this conversation with people and you say, we're considering it smoke-free housing, the reaction you may get is, oh, so you're kicking me out. Well, no, that's not what I said. I said we're trying to, create a more healthy environment for all of our tenants because we have smokers and non-smokers. So you really have to couch that in what your end goal is. Your end goal is not to evict or kick out the smokers. Your end goal is to have a healthy building. I'm not saying that you have to quit. I'd love to give you some resources to help you if that's what you're interested in. I'm merely saying that in my building or on my property, I'd like you to not smoke because it's affecting other people. And it's affecting your dog or your cat or your child who don't have a choice about the smoke, and the other residents who don't have a choice.
Thank you. So, Rebecca, what are some options if I am a smoker and I'm in a unit that is now has a policy? Are there things like nicotine replacement, or what options are available to us? And as well as even for medical marijuana, so that I wouldn't have to stop something I need for medical need, what are some suggestions or recommendations around that?
So for quitting smoking, we're so lucky in the state of Vermont to have free resources. Troy held up these brochures, but 802 quits, and people can get. So the most effective way to quit smoking is to get some sort of counseling support and combine it with nicotine replacement therapy. So you can get both of those for free. You can call the quit line and get free support on the phone. There's you can sign up online and talk to other smokers as part of that. And then the third option is to sign up for the in-person programs, which is offered through the hospital here in Bennington, as well as statewide. And then smokers, once they're enrolled in a program, can get access to free nicotine replacement therapy in the form of a patch, gum, or lozenge through the state. And you can actually even have it direct shipped to your home, which is great. So that's fantastic. And then if you happen to have Medicaid, the state of Vermont has a very robust support for smoking cessation. It extends it beyond the regular nicotine replacement therapy. So if you need another prescription medication, they'll cover the cost of that. So the state does a great job of making it as easy as possible to kick this really difficult addiction. So that's great. In terms of medical marijuana, I would recommend that a patient talk to their physician, because there are other ways to take it in, including tonics. I just talked to a woman who actually combines the plant with some oil, and that relieves her pain, her chronic pain. So she's not smoking at all. She's using some sort of tonic in lieu of that. That's really helped her. But that's a conversation that should take place with the physician.
Well, that's good to know. I think it's important to be able to say that this isn't just we're trying to put our thumb down on anyone or recommending putting your thumb down on anyone,
Right.
but that there is a world of options to make this work for everyone.
Yes.
So, and again, an understanding, as you said, Troy, that this is you're having these individuals staying within your property under the hopes that they're going to take good care of it as well. And so you're trying to work together collaboratively to find ways to make sure that investment remains valuable. So what actually are the costs for converting over a unit? We didn't even talk about that. There's a cost to everything.
Well, I shared some numbers last night that
Yeah.
I think everybody in the room agreed they were really dated and not doesn't reflect the real cost of a turnover. But what I just read a survey of managers in Colorado who said a smoker's apartment costs about $6,000 to turn over, compared to a non-smoking unit, which is $2,000. So Troy would know those numbers better than I.
Yeah, the cost to if you are a landlord and you do a regular cleaning in between tenants, you know what that takes. And to clean an apartment where somebody has been smoking even for a year or two, much less somebody who's been smoking for 20 years, and I've been in those apartments here in Bennington. The cleaning process is just so much more intensive and so much more expensive because that nicotine builds up on every surface in the apartment. So there's a process to get that cleaned, and it seeps into every surface, and the secondhand smoke seeps into everything, and it over time, especially many years, it seeps into the drywall and it seeps into all of the surfaces. So a lot of times it's not surface cleaning. You may have to gut after somebody's been in for many years. So the longer the exposure, the more expensive it's going to be. So the $6,000, may be a valid estimate for a unit that's had a long-term smoker in it, and long-term only being a few years. There are some things you can do for somebody who's converting a unit that's only been a few years, and that's the surface cleaning, painting. There's some paints that you can use to seal surfaces. There's also a machine called an ozone generator, which you can rent online. They mail it to you, and then you use it for a couple days in an enclosed environment, and then you mail it back to them. And that's a very inexpensive process. We have rented them so often that we actually bought one. So we now have one in our office, and we're developing a rental program for people that we deal with, just because it's a great machine that eliminates a lot of odors in units, and it's been very successful at eliminating smoking odors. So that's a machine. It's called an ozone generator, and that's a machine to look into if you are doing a conversion. Hotels use these machines frequently in their smoking rooms. So that process is expensive and it's time consuming. So when you look at your profitability at the end of the year, you really have to take that into account. And buyers of these multifamily units, when you eventually want to think about selling, they're looking at that because that will devalue. So you're not going to get as much at the end of the road when it comes time to sell these properties. So if you're looking at your time horizon, you're looking at retirement from the business, this is a process that you may want to start to undertake because smoke-free properties will sell for more.
And I would like to add, in addition to the turnover, is the fire safety aspect of this, and that a fire, leads to, sometimes up to, millions of dollars in damage.
Yep.
There was actually a fire in Williston a couple years ago, and it was a hotel fire, but the receptacle for the butts was right outside the door. And what happened is that person put it in there, and it started to ignite, and it actually went inside the building and jumped up above the sprinklers. So set off the sprinklers and did, I can't remember, ridiculous amount of damage from the sprinklers. So there's that. Vermont has the fire safe cigarette law in place, as well as every state in the country, but that doesn't mean they're fireproof. So there's still a risk of fire damage. In fact, that's the leading cause of civilian fire deaths in Vermont, is smoking materials.
Wow, that's really terrifying.
It is, yeah.
It is.
Yeah.
It is. But this is really, really valuable information, and I would like to let you know that we will provide all of the websites for the American Lung Association, Maple Leaf Realty, and of course the Alliance for Community Transformations. And you're welcome to contact any of us with questions around that. As a local coalition, we're also available to help with that process. So we're available to help answering any questions, helping you create a timeline. The state also has available some really great smoke-free zone signage. We have some on hand and can help you connect up to get more if you'd like to have some. That's a recommendation I would put out there for the properties that we have worked with, because most don't really know if you are going to have an outdoor perimeter, say 50 feet. Most people have no clue what 50 feet actually is. They couldn't tell you how far 50 feet is. So even using the signage as a marker to be able to say, this is where it's at, and this is where we're asking you to take your smoke to. The other pieces that we also can provide, there's some great scripts and ways to be able to have those dialogues, both as a tenant, as an owner, for staff that may be coming in and doing work. It's really for the protection of everyone that's there, and there's some great ways to be able to engage and let people know, you're not in this alone, but we do want to let you know that this policy exists. Working with your tenants, I think, is going to be the real key. They have a trusting relationship with you as the landlord, and you want to maintain that. And so really being able to feel like they can come as an open door situation and ask whatever questions, and that they're not dumb questions, that they won't be shut out, I think is important. So making sure that there's mechanisms for letting others know. Tobacco is the hardest addiction to overcome by far. It beats out cocaine and heroin. And so it's a real difficult process for someone to go through to become quit. So this is giving one more way to try to help support individuals that we care about and our customers. So any other final thoughts or anything that you would like to share today?
I just want to point out a website that we have that's very simple, and it's for managers, owners, and residents as well, and it's smokefreehousingbT.org. I'll share that with Kiah as well, but check that out. It's pretty easy to find resources on there, including some sample letters to property owners and surveys and that kind of thing.
That's great. That's great. Troy, and where is your website?
Our website is mapleleafvermont.com, And I just want to say, if there's anyone who couldn't make it to the live seminar who has a situation that they would like some advice on, there's probably nothing I haven't seen or heard about, and I'd be happy to talk with you about your situation and give you any advice that I could. Sometimes I will refer you to an attorney, but if I have anything any light to shed on what you might be going through, I'd be happy to do that.
Great. And our website is actbennington.org, and we'll make sure that you have that information. We're also on Instagram, Twitter, and Facebook. So I want to thank you, Rebecca, and thank you, Troy, so much for being a part of this conversation. This is really great information, and it's all in support of helping to make a healthier community and a healthier Bennington region. Thank you so much.
Sure.
Thank you, Kai.
And thank you.